Hello, my name is Cadence Bartholomew, and I'm a nursing major at Commonwealth University, the Bloomsburg campus. Today, I'm going to be discussing the global shortages of nursing. I chose to do this topic because it's very interesting to me, as it is what I want to become when I get older, and what I'm going to school for now. Next, I wanted to get into what is nursing. So nursing is an extremely tough, sometimes very sad job, but can also be the most rewarding experience of a person's life. Nursing is also a combination of learning about patients who are of all ages, genders, ethnicities, and taking care of people who are very sick, mildly sick, healthy, need someone to talk to, even hold their hand, be there for them, and nurses just truly do everything in a hospital that they can to help. Nursing also takes place in every community or setting across the world, which is why it is globally for everywhere. So why are nurses important? Well, nurses help to diagnose diseases, assist in activities such as bed baths, linen changes, talking with the patient, administering medication to the patient, talking with the doctors about the plan of action or any questions that the nurses may have or the patients may have, talking to the patient's family, and lastly, they help the patients to feel welcome in the chapter of their lives where the nurses are caring for them, even if it may be a very hard chapter. All of the above information shows why they are the most important, because they are truly the backbone of nursing, and it's what makes a hospital what it is today. Some statistics on nursing is that prior to COVID coming along, the shortage of nurses was about 5.9 million across the world. As I did further research, I found out that by the year 2030, the shortage was expected to be 13 million across the world. So the shortage actually is expected to increase by 7 million. Another statistic of nursing is that the need for healthcare grows year by year, day by day. Next, I found a map, just of the U.S., because I could not find a global one, but I found a map, and so the light blue is 15% or less of nurses that they are short-staffed. Some of these states include California and Texas, and there are a couple more. Then, as we keep going up the totem pole, 15 to 30%, which is the teal color, there's about 16 states in DC that include 15 to 30% of short staffing of nurses, and some of these states are Nevada, Utah, or Arizona. Next, the dark blue, which is 30 to 50% of nurses that 30% of hospitals and nursing that are short staffed, include states such as Oregon, Idaho, Colorado, and Oklahoma. And there are actually 20 states altogether. And then as we go up further, 50% or more, so 50% short of staff or even more, is the orange. And these are 8 states, and some of these states are Kansas, Wyoming, and Alaska. So, as I said, this is a map of the facilities that are actually reporting having staff shortages, and this is as of March 20th, 2022, and this number just continues to grow. We're not ready for what they were going to see, but I was just focusing on nurses throughout this pandemic. So now these are the issues being faced throughout this global shortage of nursing. So the first issue is personnel shortage, which this means that the floors did not have enough people to work for the amount of patients that they had. The next issue being faced was insufficient recruitment and or retention on these floors. The next issue was migration of qualified workers. So the workers went to school, they did what they were supposed to, but then they came in and they did not like it because of COVID, or just because COVID was the main thing. So they migrated out of that workplace. Then the fourth thing was unattractive working conditions and stipulations. Some stipulations that COVID caused that nurses continue to do today are gowning, even more gowning. Nurses having to wear glasses, masks that covered their face more and didn't let as many particles and bacteria in. And then some nurses had to wear nets on their head just to cover their hair, and then gloves were worn more than they were before, just to make sure that the COVID and any other diseases did not get spread. And then there was poor access to development and opportunities for nurses. So I found this picture, and this is just a nurse during COVID. She's truly burnt out. She's tired. She keeps on going, but as you can see, this is a picture of her. She has her gown, gloves on, a mask, and then she has glasses on and a hairnet on to not contract this disease or any other disease. So why has the shortage of nursing become a global issue? The main reason is that there is not enough staff to take care of patients. So there's not enough staff for the staff to patient ratio in order for it to be safe some of the time. And then that during and after the pandemic, this issue actually spread. The shortage of nurses actually spread. So what is the main point to take away from this presentation? The main point taking away from this presentation is that nursing is very important. Every hospital needs nurses. They are the backbone of hospitals. And during COVID really dampened these numbers of nurses. And even today, these numbers are decreasing and there is a shortage. So the biggest takeaway is that there is an extreme shortage, but the world needs nurses. Thank you for your time and listening to my presentation, and I hope you have a great rest of your day.